Hi, everybody. I'm Dr. DePerrier, and I have put together a little presentation here to talk about your last visit prior to surgery. Now, this is not in place of you doing what's called your final history and physical with one of our doctors, but it's just sort of a heads up of what we're going to be talking about and discussing, and hopefully will lead to fewer questions and more clarity about what will be coming up in the very near future. So first, congratulations for getting this far. This is very exciting. And it's normal to be a little nervous. If you weren't a little nervous, it might be a little weird with your upcoming surgery. But the point of today is to cross the T's and to dot the I's. And what we're going to talk about right now is how I typically see a patient at their last visit prior to surgery. And I like to think of this in three parts: the everything that's been done on the preoperative side, what to expect on the day or day after surgery, and then what to expect after you've been discharged from the hospital. All right, so part one, the preoperative side. Well, there's a couple things that we want you to do. For example, we want you to go to the pharmacy and make sure all your prescriptions are picked up ahead of time. We're going to discuss the preoperative diet and your preoperative labs and any preoperative procedures or clearances that have been obtained. And we're also going to be reviewing all of your medications that you're currently on. Now, you want to bring all your medications to your final appointment so that we have an accurate representation of what you're currently taking. And you want to do the same thing when you go to the hospital. When you come in to see us on this last visit, in addition to going through all your medications, we're going to go over some medications that we've already electronically prescribed for you. And this list here is a representation of those medications. So, for example, the top one, apripantant, I never can say that very well, but that's also called Emend. And that's one pill that you will take by mouth before the surgery to help prevent nausea after surgery. And typically, we ask our patients to take that when you're driving to the hospital or when you're parking the car when you're on your day of surgery. So you'll take that by mouth and then you'll go in and check in at the hospital. We're also prescribing some Lovenox injections to help prevent blood clots. This is something that you will take if you're having a sleeve gastrectomy or a duodenal switch. It's something that you will administer yourself once a day, every day for 1 week if you are a sleeve or a duodenal switch patient. So the way I remember that is 1-1-1. One injection once a day for 1 week. There's also your prescription for pain medicine, and then we give you some medication for reflux and nausea if needed. Ursodiol is something that will improve and change the solubility of your bile so that you won't develop gallstones. We want you to be on this for 6 months, and hopefully it will prevent you from developing gallstones. When you lose weight rapidly, that's a nidus for stone formation, and so you would be at increased risk for developing gallstones if you don't take this medication. If we already know that we're taking your gallbladder out, we are going to ask you to take this medication until your gallbladder is removed. Now, please, 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 I'm begging you to pick up all your prescriptions days before the surgery. Don't wait until the last minute, because especially on the day of surgery, it's very difficult to be scrambling around, electronically prescribing, looking for a script. You get the point. Please have everything picked up ahead of time. It's really can be, very challenging and frustrating if you're trying to leave the hospital, but you don't have your prescriptions and stuff ahead of time. Like I said earlier, bring all your medications to the hospital, including your Lovenox injections, and the nursing staff will teach you how to administer it to yourself. Okay, so our dietitians are wonderful, and they have instructed you by this point about your preoperative diet. And that's typically something that you want to be on for 10 to 14 days prior to surgery. Now, typically, depending on the patient, I oftentimes will give patients some latitude. I will say, look, have an extra shake, have a handful of fajita meat, have a bowl full of almonds. I'm okay with that. I don't want you getting hungry or grumpy or, kicking the dog when you get home because you're so fatigued and tired, or kicking your spouse. You don't need that right now. So have some more protein, have, higher fat, higher protein, lower carb. I'm okay with that. But what to take away from this is that it's a very important inflection point in the rest of your journey, right? So make this a reflective time where you're like, okay, I got to make some good decisions here, because you're going to have your weight loss surgery for the rest of your life. And this is an important inflection point to make good decisions. Also, leading up to surgery, we expect you to be walking every day. And those last 2 weeks prior to surgery, personally, I'm not as concerned with weight loss as I am inches. So I really want patients to walk every day and be physically prepared for their surgery. If this applies to you, you need to know when to stop your blood thinners. Okay, that's very important. You don't want to show up at the hospital and be like, oh yeah, I'm still on my Eliquis or Coumadin. That's not going to work, and the surgery will need to be postponed. I would also say at this time, it's very important that you purchase your supplements from our store. Okay, our dietitians have done a terrific job of vetting out our products, and they're very knowledgeable, much more so than even the providers and doctors. And so we rely on them to help us make the decisions of what to carry in our store. And we want you to buy the products from our office. We recommend that you buy your protein shakes and soups. And I would personally pay attention to the top shelf of what we have, because that's how you're going to get some variety. You're going to be on a liquid diet for 3 weeks in almost all cases. And quite honestly, liquids are boring, and I apologize in advance, but the top shelf of our store has the most variety, and you can get, some higher protein products in the form of a different flavored bouillon or teas or hot chocolate or coffee, for example. So these are things where, I want you to buy your products ahead of time. I want you to prepare them ahead of time, because your taste buds can sometimes get a little weird after surgery. And let's try to minimize the number of surprises. Yes, you might be able to find some of our products a little less expensive in certain places, but you know what? It's support the practice. We tell our patients that if there's any profit or markup on our nutrition stuff, we put it towards the holiday party at the end of the year. But please support the practice, particularly if you're getting a duodenal switch. I really want you to buy your ADEC vitamins from us and us only. All right, so back to the preoperative diet. I mentioned 2 shakes and 1 lean meal. If you're having some breakthrough issues, I mentioned, having some extra hard-boiled eggs, some bacon, a handful of almonds, etc. But what if you had questions prior to the surgery about your pre-op diet? What would you do? And I'm going to ask you this when you come for your last appointment. And the answer is, I'm going to reach out to the dietitian. I'm going to be like, that's right. You can call them, you can email them. They're terrific sources. And we highly recommend that you reach out to them. Now, the last 24 hours prior to surgery, we respectfully ask that you be on liquids only. Liquids only. We don't want to take a chance of you having some food that doesn't get out of your stomach, because that is something that we would find out only once we're in the operating room, and we would have to back out and postpone your surgery. So liquids only for 24 hours. Also in this preoperative phase, at that appointment, we're going to be reviewing your labs. We're going to be reviewing your procedures. If you had an ultrasound of your heart or of your gallbladder, or if you had a cardiac clearance, gastric emptying study, we are going to go over those results with you. And we're also going to go over your labs. Now, you might have labs from our very first appointment when we met, and you'll also have some what we call preoperative labs, which are usually done, hopefully about 2 weeks prior to surgery. Now, in the time of this pandemic, some of the labs are getting done right before surgery at the time of your COVID shot, and that's not unusual, but we're still going to check your labs as best we can. It's very common during this time to find that, your iron is a little bit on the low side, and in which case we will make plans to give you an iron infusion while you're at the hospital. We might find that your vitamin D is a little low. We might ask you to buy some extra vitamin D while you're here at this appointment. So that's a time to be reviewing your labs. If you want a copy of the labs, no problem. Send them to your primary care doctor, etc. Okay, we're also going to be reviewing your current medication. So it's very important that you provide us with an updated list. And it's critical to know, if you're on any blood thinners, if you take steroids on a routine basis, and also if you're on any diabetic medications. because we are going to have you stop your diabetic medications 1 to 2 days prior to surgery in some cases. And now that there's some other newer medications like Ozempic or any other similar med like that, they need to be stopped a full week prior to surgery. Now, for example, I just walked out of a room with a patient and they're on Ozempic and they get it every Thursday. And so their surgery is scheduled on a Monday. So you have to be off of that Ozempic for a minimum of 1 week. So in her case that I'm mentioning, she's going to be off it for 10 or 11 days, whatever it was. So make sure that you are not on Ozempic or similar meds. And the reason is Ozempic is a terrific medication. Love it. However, it does delay your gastric emptying. And so it's very common for patients that are on Ozempic, they'll have, you could have surgery and their stomach will still be full of food from the day before or 2 days before. And that's going to stop your surgery from happening right there. So please, no Ozempic or similar meds for a week before. And like I said, we're going to review your clearances and tests that we ordered. And at that time, we're also going to, if you have sleep apnea, we're going to make sure that you have your CPAP machine. Okay, so I just saw someone and they, for some reason, they had apnea, but the the pulmonologist never notified them that they should have been on a CPAP machine. Well, now their surgery is scheduled in a couple of weeks. I'm not sure if we're going to be able to do it because I want you on your CPAP machine prior to the surgery. I want you comfortable wearing it because you're expected to be wearing it for 6 months after the surgery. You're going to bring it to the hospital. It's very, very important. If you have sleep apnea and you're not wearing a mask or you refuse to wear a mask, our office is going to be having you sign a waiver form that you're not going to hold us responsible for bad things that could be related to your apnea. All right, so we cleared all those things and now it's time for the day of surgery. What to expect? Well, I told you you're going to take your amend when you pull up to the hospital or when you're parking the car. And we talked about not taking any diabetic medications on the day of surgery. Be there a couple of hours early, be prepared to be bored, bring your CPAP machine, and please tell your family to answer any phone calls while you are at the hospital. You would be surprised how many people just don't pick up the phone because the hospital number, will say, oh, possible spam. And so it's very frustrating as your provider. I don't like leaving a message about, your what happened on the surgery or how you're doing. It's no one else's business as far as I'm concerned. But then family members will get mad and say, well, no one called me. And I did call you a couple of times, but it went to the spam filter. So make sure that the family is prepared and ready to answer the phone. If you're having a sleeve, you will either be going home the same day or you'll stay 1 night or 2 nights. Generally, it's either the same day or 2 nights. If your surgery is at the Foundation Hospital, we typically ask you to stay for 2 nights. We want to watch your heart rate, your blood pressure, your temperature, your urine, your labs. You get the point. We're not going to let you leave the hospital unless we think you look perfect. Same thing with the switch and bypass patients. Be prepared to spend 2 nights at the hospital. Okay, so now you've had your surgery, you're doing great, and now it's time to be discharged from the hospital. Well, let me go back. While you're at the hospital, the diet, if you're there for 2 nights, you will be on a clear liquid diet. So typically that's sugar-free popsicles and ice chips. And I tell you that because that's important after you are discharged from the hospital. And I'll get to that in a second. All right, you're discharged from the hospital. First off, let me tell you, there are no restrictions on you once you leave the hospital. Okay, so you could go home, you can work in the yard, you can work on the house, you can work on your car. You're not going to really feel like doing those things, but you could if you wanted to show off. Okay. You're going to have some pain typically, and that's usually over on your right side here underneath your rib cage, but a little bit closer to your belly button. And that's typically what we call the extraction site. And that's an area that could give you some pain. You might feel some pulling, some tearing, some stretching or spasm or knife-like pain. If you were to push on the incision, you might feel like or appreciate like what feels like a ball underneath the incision. And that's totally normal. And you're not going to hurt yourself if you were out doing these, doing things. Now we expect you to be walking every day. And again, you're going to have a little bit of mild pain where I was describing. You're going to resume your regular routine medications. And if you're a diabetic, it's a little bit different. We want you to keep a record of your blood sugars if in fact you are taking your blood sugars on a routine basis. Okay, so it's very important. We're going to ask you to take your blood sugars in the morning and take them in the evening. Morning, evening, morning, evening. And then you'll come and you'll bring us at your post-op appointment, you'll bring us your diary of your sugars and we'll check out what your blood sugars are doing. Ideally, we want you to be off all of your medications, all of your diabetic medications when you leave the hospital, okay? But you must take some ownership and accountability for this. If your blood sugars are consistently in the 140, 150, or 160 range, we want you to bring back on some of your insulin or some of the other medications, typically at about a third of the dose. Okay, so let's pretend you're on 100 units of insulin prior to the surgery. You have your surgery, you go home, you're checking your blood sugars every day, and they're, like I said, above 140, 150, 160 on a routine basis. Then instead of taking 100 units, you'd go to 25 or to 30 units. Okay, so about 1/3 of the dose if your blood sugars are high. Now, you can expect that your blood sugars are going to be all over the place in the first 24 to 48 hours after surgery. Okay. All right. So just don't be surprised with the little lability of your blood sugars initially. They'll even out. Okay, when you go back to work, most patients return to work in about 2 weeks, but everyone has different work motivations. Okay, everybody's motivations for going to work are different. We typically tell you to tell your employer, I need 2 weeks off, but I would say the overwhelming majority of patients go back within 1 week, and then it looks like you're going back a week early and you look like a stud, and that's what we want. All right, I mentioned, please always purchase your supplements from our office. After discharge from the hospital, you should already have your first initial post-operative visit in our office, and that is in person. Okay, so even if you live out of town and you're coming to San Antonio having your surgery, the expectation is that you will have your first appointment here in our office. We're going to do an upper GI on your surgery and we're going to show it to you. So bring your phone, bring your camera. You're probably going to be like, oh, that's so cool, I want to take a picture, and we encourage you to do so. And at that time, we will adjust your medications as needed if necessary. Other topics, like I said, we want you to wear your CPAP for 3 to 6 months after the surgery. Some insurance companies, some doctors' offices are going to make you do another sleep study after 6 months to prove that you don't have apnea. Everybody, all these plans are a little different, but again, we want you to plan on wearing your CPAP for 3 to 6 months. Resume your vitamins when you're ready after surgery. Typically, I tell you to take a couple days off and you can start resuming your vitamins several days after leaving the hospital. You are not required to chew your vitamins, despite what everything you hear and read on the internet that says you must chew for however many weeks. That's not true. You can swallow your vitamins. I have no problem with that. But you are on a liquid diet for the first several weeks after surgery. The only time I want you using your teeth is if you want to chew your vitamins. And remember, if for some reason you're having a problem and you're having vomiting, vomiting is never normal under any circumstances. I don't care if you're 5 or 75. And so if you're having vomiting, that should prompt a phone call to the office. Okay, remember, people that follow up more will tend to lose more weight. Okay, so this isn't a slash and dash kind of program that we have here. We expect you to be following up on a routine basis. The more you follow up, the better. If you don't have any surgical issues, we want you to follow up with our terrific nurse practitioners or physician's assistant. And the more times you make contact with the office, the better. If you are a bypass patient, you are forbidden from taking aspirin, ibuprofen, Aleve. It's very important that you obey this rule. Also, please pay attention to the color of your urine. If your urine is getting dark or concentrated, that would be a sign that, hey, maybe I'm not getting enough water or fluid. Please don't get dehydrated. Please call us. You should weigh more when you leave the hospital than when you got there from all the fluid that we give you, and you'll pee it off over the next couple of days. But pay attention to your urine. If it's getting dark and concentrated, we might actually have you come in and get some IV fluids. All right. If you're not feeling perfect, we expect a phone call. You should be feeling a little bit better almost every day. And remember, it's 3 weeks of liquids after surgery. That is not negotiable. Okay. And then when you come for your initial follow-up, you need to make your appointment for your 6-week post-op visit. We want you to do our medical weight loss program after surgery. All the providers, the surgeons are a little different, but somewhere between 6 months to 12 months after your surgery, we might ask you to come back and do medical weight loss with us to augment your surgical weight loss. That's a pretty typical conversation, especially if your weight loss from the surgery is starting to stall or slow down. But this is an excellent way for you to keep your weight from coming back, and we highly recommend it. All right, so that is the end of the talk. I hope that that was helpful. I hope that that will lead to fewer questions and concerns, and you can watch it as many times as you like. Once again, congratulations getting this far. We're looking forward to seeing less of you. Get it? All right, thanks for watching.